can we remove an abscess from above the coccyx bone? So the coccyx is the tail bone, the sort of bottom of your spine, at the top of your natal cleft on your bottom. And so this sounds like a pilonidal abscess, which is a common problem in that area, just above your coccyx bone. And they're extremely difficult to fix. So pilonidal abscess, pilonidal sinus, they're very difficult to treat, and they're usually they're often caused by like hairs on the back which can fall into the natal cleft, and if you get it's a sort of hot and sweaty area, so the hair kind of grows in and it forms an abscess, and they're very difficult to treat, and we don't tend to treat them. So no, it's usually general surgeons who would do that. You usually have to kind of lay it open. In fact, to be honest with you, abscesses in general, actually, we can widen this one out. Actually, we can widen this question out to abscesses. Do we treat abscesses? So we don't treat abscesses. That would be more of a general surgeon or sort of A&E type thing that would treat an abscess. So if you've got a cyst or something like that, we sometimes get calls from people who've got cysts that are infected, they're red, they're angry, and we don't really treat them when they're like that. We would say, look, you might need some antibiotics, you might even need some draining, lancing, let the evil humours out, stuff like that. But we don't get involved with that sort of acute management of it. So we don't get involved with abscess, management of abscess. Abscesses, sometimes it needs drainage, often it needs antibiotics. Once it's all calmed down, then we often do get involved. But specifically for this coccyx bone situation, if there was a pilonidal abscess, sort of the coccyx on the sort of top of your buttocks, we would not do that. That would be a general surgeon, because usually the treatment of the abscess, laying it open, you need to pack it, and you often need daily dressings, and it's quite labour intensive with nursing and often district nurse, stuff like that. So it's a kind of different sort of infrastructure than what we're set up for. We're set up for clean surgery. We don't tend to do infected cases. So as I say, if you've got an infection, we would say to you, look, you need to get the infection sorted, and then we would deal with it once the infection's sorted, if there is a cyst, an underlying cyst or what have you. But these abscesses around the coccyx often need prolonged dressings, and they're kind of healing from the inside out. And then once they're completely healed, then that's kind of the treatment for it. They don't need any more treatment after that. But it's not really our area of expertise. So yeah, pilonidal sinus, pilonidal abscess would be more of a general surgeon.